3 dots.
Yeah, so I've started, hopefully. Yeah. Brilliant. So before we do start, so this is not me in clinical practice. So this is a video of I suppose a session that's not going too well and doesn't fit to the standards or competencies, whether it's Rotherbilling or BABCP or the CTSr. So the idea really is to painfully listen through this 20-25 minute, 30-minute session, and to use the CTSr to evaluate it as you would do with any other session, and then consider how you might give feedback to the student. And the idea being that we can then look at parity across all of us as supervisors on the course, but also we can look at how we give bad news, or how we deliver feedback for somebody who isn't doing particularly well or needs to refocus. So myself and Lowri, both lecturers at UCLan, will start now. So thank you very much, Lowri, for joining me for today's session. I think this is the first time that we've met.
Yeah.
Yeah. Okay. So my name's Brian, and I'm a trainee cognitive behavioural psychotherapist. I think in terms of cognitive behavioural therapy, we often start a session with an agenda. So agenda setting. So I've got a few things on the agenda for today because it's your first session. I'd like to know a little bit about what brings you for therapy, what brings you to this today, and also I'd like to complete a 5 areas assessment of that, a 5 areas formulation, but it'll come all clear as we kind of progress and get to that point. And there may be very briefly to have a look at a problem statement and some goals for you in terms of therapy. So that's what we're going to go to do today. Just around confidentiality, just to let you kind of know about confidentiality. I mean, anything you do say in terms of confidentiality is between you and I. I mean, there are caveats to that. You know, if you tell me that you're going to harm yourself or somebody else, then I might have to consider breaking that confidentiality. I'll discuss that with you first when that comes up, or if it does come up. That might be that we agree to break the confidentiality, and I might tell the police, or I might tell you next of kin, or does that sound okay? Yeah. Okay. So that sounds fine. That sounds fine with you. I mean, the other thing, just noting confidentiality. I mean, obviously we're online, and I'm recording the session for supervision. Now that just means that when I record the session for supervision, my clinical supervisor might review the session and score me, mark me in terms of how well I'm doing, and give me pointers in terms of improvement. But the benefit of that is that you get the eyes of 2 therapists really as well, not just myself. And what do you think?
So there's 2 people watching this now, or will be?
No, it might be. It might be that I might submit this as an assessment for the supervisor to assess me with, and they might listen to the recording. They might give me some advice in terms of therapy, in terms of the way that we're going.
Yeah. Okay. I suppose no one else is watching it.
Okay. So as long as no one else is watching it, you're okay with that. Sounds like. Good, thank you for that. So just confirm that really. What I should say, nobody will come into here, but I'm in my kitchen with therapy, and although my husband's at home working from home as well, they can't hear us. We can't, shouldn't be able to hear them at all.
Do you want a cup of tea?
Yes, sorry about that. I don't know what happened there. Coming in and asking whether I want a cup of tea. I take it you don't want a cup of tea. I've got one.
It's fine, thanks.
Yeah, fine. Okay. So we'll make a start if that's okay. So I'm just wondering if you can outline why you've come in to therapy, or what brings you here today.
Well, I've just been struggling with I feel very anxious at the minute. I've had some difficult times recently with gone through a divorce, and it's not been good, and I'm just kind of struggling really, and I keep having these kind of sort of, I suppose they're like panic attacks, but sometimes I'm not sure. So
feeling anxious.
Yeah.
And that kind of you've been going through. So you're going through a separation, a divorce.
Yeah, it's been going on for about a year, but it's been quite difficult, and I've had to have a solicitor, and there's been quite a lot of difficulty in terms of the financial settlement and childcare and stuff, and it's been pretty tough. So and then on top of that, I've been having to keep going to work and look after the kids and everything. So but like mainly it's just these attacks that I'm having. I'm starting to get like quite worried about it, and I'm not really coping very well.
So a feeling of panic and a feeling of that you're not coping well with that.
Yeah.
Okay, I'm just wondering whether I'll share my screen with you. Just 1 second, I need to work it out. It's very difficult to kind of get used to all this technology sometimes, and it's a little new to me as well. So, so just 1 second. I should. Oh, sorry, just 1 second. I'll find the document I was just about to share with you there as well. Oh, there it is. There it is. Okay, sorry about that. You might see my messy screen with lots of things on it there. So in terms of, if we look at this is kind of 5 areas formulation, because it starts with the situation that brings us to therapy, and gets us kind of to consider how we might be thinking, feeling, how we cope right now, and what experiences we have inside the body that may be often connected to the way that we're feeling. And then we'll kind of focus in on a bit of a problem statement for today and some goals, as I said. So just thinking about that situation you've already said, I'm going to type in as we go along, if that's okay with you. So you said that you've been going through a separation. And it's been for the past 12 months now.
Yeah.
And it sounds like you said that there's a lot going on. Children at home as well. And I have been anxious and experiencing panic, you said.
Yeah.
Been experiencing panic, and so in terms of kind of, I mean, I suppose what does that? How has that felt like? What have you been feeling like when you've been experiencing that panic, or that anxiety?
I just start to kind of struggle breathing, and I get really hot and my heart starts racing.
Those sound like lots of sensations or feelings much inside the body. So you see your heart's racing.
Yeah.
And the heart's racing, and you say breathing.
Yeah, I just struggle to take in a breath. I feel like I can't breathe, and I get really like dizzy. And sometimes when it's really bad, I just kind of feel really weird, like it's, you know, like I'm floating outside of myself or something.
Kind of in terms of what thoughts, what starts to kind of happen as your what thoughts go through your head? How do you think about this? What the time that you're feeling this?
I just think I can't cope, and don't want my kids to see it happening to me.
Don't want my kids to see this happening to me. And that kind of, so how are you feeling right now when you're talking about this?
It just makes me really upset.
It makes you feel upset. And when you're feeling upset, what other thoughts go through your mind?
That I'm going to lose my job, and that I'm a bad mum.
And how are you coping at the moment with those thoughts?
I don't feel like I am coping, and I try to, like my mum has been quite good, and I phone her if I'm having a bad moment, and she sort of helps calm me down on the phone, and sometimes she'll come over and look after the kids for me. But I'm struggling to go out and do things I need to do. I haven't actually managed to go to a supermarket for quite a few weeks now because I had quite a bad attack when I was out, and I nearly left my kids in the middle of the supermarket.
You nearly ran out and left your children in the supermarket.
Yeah.
And how do you feel about that?
I feel awful. Obviously, I didn't leave them there, but I had such a bad attack. I felt I had to just get out. So I started to walk away, and then I went back and I grabbed them, and I managed to get us all outside.
Yeah. So you had to escape.
Yeah.
Get everybody outside. Okay. And how often does this experience, what we looked at here today, how often does that experience take place?
Well, the last time that happened was, like I said, about 2 weeks ago, but then I do have some sort of small anxiety attacks at home, and
what makes those anxiety attacks at home happen?
I don't know. It just seems to come out of nowhere. I can be like making tea, and then all of a sudden I'm just literally having to hold on to the side in the kitchen and calm myself down. I don't know why it happens.
So in terms of kind of what might help here is if we have a look at a problem statement then. But before we do you notice anything about these boxes? You know, you've got the situation here that we described, and you can see all these arrows here in between. Can you see any connections between thoughts, feelings, and what we've spoken about today?
I think that I'm just, you know, kind of repeating the same patterns. Maybe I don't know.
So maybe you're repeating the same patterns going around.
Yeah.
And we'll get to know a little bit more about these boxes and what they mean. But you know, we haven't got a lot of time today, given it's our first session. So I just want to kind of move on to a problem statement and see whether we can pull something together as a sentence or two that describes how you're feeling right now. So what would you say is your problem at the moment? If you were to start sentences, my problem is.
My problem is that I'm really anxious.
Yeah. And so if you think about kind of my problem is that I'm really anxious, and this makes me think
I can't cope.
I can't cope. And when I think this, it makes me feel
awful.
Awful. And I cope with this by
relying on my mum.
Relying on my mum and you said you avoid things.
Oh, I avoid going to the supermarket. Or just going out, I suppose.
So we'll return back to this problem statement at time again. But I'm just wondering, what are your goals then for therapy? What do you want to get out of this time together?
I just need to be able to cope with my anxiety better and need to improve how I feel so that I can cope with, you know, going through this divorce. It's quite stressful. I suppose I want to improve my confidence, you know, because I, you know, want to be there for my kids.
Can't spell at all here. Okay, so be able to cope better with anxiety, improve how I feel, cope better with the divorce, and improve my confidence.
Yeah.
Okay, that's really good. So we'll have a look at those that problem statements and those goals again in the future. I'm just going to stop sharing for now. What do you know about cognitive behavioural therapy?
Not a lot really, just that it's like one of my friends recommended it. She said that it worked for her. It's quite a good way of learning good coping techniques and stuff.
Yeah, it's really good for that. It's really good. It's great. I mean, cognitive. I mean, that kind of is a strange word. It stands for thinking. A bit like cogs going around, and talk about our thinking. And then, of course, you have emotions, and that's how we feel about certain things. You know, you said that you feel awful sometimes. And thoughts and emotions are connected together a little. So, you know, like you were saying before, that you think that you were in that supermarket and you felt like running out, and you would have at that point maybe had to have left your children in the supermarket, and so therefore you thought that you were a bad mother, and being a bad being a bad mother, or thinking about being a bad mother, you then felt awful. So the thoughts and the emotions were interconnected. And then, of course, what you're doing is you're then, in terms of emotions and behavior, thoughts, emotions, and behavior are connected. So those thoughts and emotions affect the way that you respond to things around you. And you were saying that actually, when you were out and about in the supermarket, that sometimes what you do is you will avoid going out now, or you avoid, so that you avoid that horrible thing happening again in the future as well. And so cognitive behavioural therapy is about working with you to help you think more positively about stuff, really. See a lighter side or a brighter side to things, and that will affect or impact your emotions, so you'll feel better. And feeling better and thinking more positively, you'll then behave in a more productive way, a more helpful way. You know, you'll be able to go to the supermarket and go shopping and do the things that you really need to do as well, and maybe kind of be able to potter around the house and do everything you need to do. And how does that sound, or does that sound okay?
Yeah, it sounds good. Yeah.
Yes, sounds really positive. I guess kind of, I mean, we're running out of time, actually. There's not much time to ask questions, but have you got any questions? I could always write those questions down and we can have a think about them the next time we meet.
I just wonder if, you know, you think I will be able to kind of overcome having the panic attacks.
Yeah, I don't see why not. You know, it'll be a bit of hard work from yourself, and I can help with that. So yeah.
Okay. Yeah, just really want to sort it out.
Oh yeah, good. That's fine. And I think, yeah, we'll be able to do that. Absolutely, 100%. We'll be able to sort it out. But just thinking, one thing that I forgot to mention as well is that you might have to. Sometimes in sessions we set homework in between sessions. So it might be an activity, or it might be a diary sheet. It might be writing something down, that can be a really important part of therapy. I mean, how do you feel about doing the homework?
Yeah, I'm you know, I'm quite happy to do that. I just yeah.
In for a penny, in for a pound. Is that what you're saying? It's okay. You don't mind?
No, I don't mind.
Well, thank you very much. Obviously, kind of, you know, we need to book in for another session. So I'm just wondering, when would you be available? When's the best time for you?
Well, Thursday afternoons are quite good, or Friday mornings.
Okay. Well, if I look at a date and appointment time for either of those two, I'll send you an appointment through for next week.
Yeah.
And we'll meet via this this app again that we've been using today.
Yeah, that sounds good. Thank you.
Very good. Thank you very much. Bye now.
Bye.